Think you know the world's biggest health crisis? It's not what you might expect. With over 1 billion people now classified as obese, obesity has become the most common form of malnutrition worldwide. The latest research from The Lancet reveals some shocking statistics, and trust me, you'll want to hear this. In today's video, we're uncovering the full story behind this global epidemic. Welcome back to Health Insights by XYZ Fitness and Health. Let's dive in. Obesity rates have been steadily climbing for decades. In the UK alone, 16.8 million people are obese, 8 million women, 7.4 million men, along with 760,000 boys and 590,000 girls. But what's really alarming is that obesity rates have more than doubled since 1990. In 1990, the obesity rate among British women was 13.8%. Fast forward to 2022, and that number has skyrocketed to 28.3%. For men, it jumped from 10.7% to 26.9%. But the UK isn't the only country facing this epidemic. According to the World Health Organization, the nations with the highest obesity rates are Tonga, American Samoa, Polynesia, and Micronesia, with the Cook Islands and Niue also ranking at the top. These small island nations are seeing alarming levels of obesity, with unhealthy diets and limited access to nutritious food contributing to the crisis. The NHS has called obesity a ticking health time bomb, predicting that by 2040, over 42 million adults in the UK could be overweight or obese. This puts immense pressure on public health services and is a major concern for the future. But it's not just about the numbers. Obesity affects every organ system in the human body. Obesity increases the risk of numerous conditions like type 2 diabetes, cancer, and mental health issues. According to Professor Simon Kenny, National Clinical Director for Children and Young People at NHS England, the impact on children is particularly alarming. Childhood obesity is rising at an unprecedented rate, and that could lead to shorter, unhappier lives. One of the most concerning trends is that childhood obesity rates have quadrupled since 1990. And for many of these kids, their risk of developing chronic diseases early in life is much higher. But while millions face obesity, hundreds of millions around the world still suffer from undernutrition, particularly in some of the poorest regions. The contrast between obesity and undernutrition highlights a global problem: malnutrition in all its forms. The NHS is taking steps to tackle extreme weight issues. A network of 30 specialist clinics offers tailored physical, psychological, and social support for young people and families struggling with obesity. But even with these efforts, the NHS can't do it alone. Experts agree. Continued collaboration across industry, society, and government is needed to turn the tide on this global epidemic. In January, the NHS introduced a new revolutionary procedure, a swallowable gastric balloon, which could save thousands of patients from undergoing surgery. This balloon, filled with water, helps patients feel fuller on less food, aiding in weight loss without the need for invasive procedures. It's a simple trip to the doctor's office. No surgery, no endoscopy, no anesthesia. The balloon stays in place for about 4 months before naturally passing through the body, making it a less invasive option for tackling obesity. While innovative treatments like the gastric balloon are steps in the right direction, tackling obesity on a global scale will require even greater efforts. It starts with education, access to healthy foods, and a commitment to making lifestyle changes. The challenge is immense, but the future of global health depends on how we act today. Thanks for watching. Be sure to like, subscribe, and hit the notification bell to stay updated with more health insights. Let us know your thoughts on the global obesity crisis in the comments below. See you next time.